Hello, my name is Lisa Emery. I'm the CIO at the Royal Marsden NHS Foundation Trust, Chair of the London CIO Council, and also Digital Health Advisory Panel member. And I just wanted to share some quick reflections around the COVID-19 response. So I landed back into the UK from Portugal on the 11th of March, so literally just back in and straight into the command and control structure that had been set up at the Trust to respond. Quickly stood up as single point of contact for digital for the organisation through the command centre. And took some very quick actions around how we were going to work. So we isolated our own digital services team, initially 50-50 working from home, and then up to that to around 90%. And also took some very quick decisions around the toolkits we would deploy, the changes we might or might not make, and the devices and support that our staff would need, along with our patients. So some of those were very fast. So we stood up Zoom for clinical MDT meetings and divisional meetings. We used the Teams platform for corporate meetings, although we were limited in our rollout at that point. We then accelerated that. And we took some other key decisions to get some of our command and control areas kitted out, for example, to manage the response. Then as our next set of steps, we deployed a virtual desktop environment. Proud of that. We built that in 9 days and deployed it. And we then took some other steps around accelerating our Office 365 rollout, putting in senior support for our MDTs, standing up virtual clinics, and then really focusing on stabilising our service and support offerings as well. Where we find ourselves now is that we are largely stable on our business as usual. We are supporting the recovery planning and effort for the organisation. Obviously, that includes a massive piece of work towards agile working and keeping that in place and improving it. And we've now started, as of towards the end of May, to stand up our strategic programmes again. So things like our EPR procurement and our digital data warehouse and other areas. So that's getting us back into that rhythm. Just very quickly, in terms of what went well, we took a very early decision along the lines of if it ain't broke, don't fix it. So we reduced the complexity of what we were offering people, and we expanded the access to the things that we knew already worked for them. We stood up the VDI solution, which I've spoken about, which unlocked personal devices and was particularly important given the difficulties we were having, like everybody was, in securing hardware at that time. So that unlocked a lot of potential and actually saved a lot of money as well, which was great. We stood up our MDTs to virtual very quickly in March, and that was really well received and continues to be so, and is something we're unlikely to go back on now. Our own team commented that they felt really safe and secure and able to deliver their service from a home environment. That freed up space, it made them more flexible in terms of their working, and it supported the organisation well. So those are the sort of broad pieces. We also had a really good uptick in terms of our clinical engagement and the engagement with our operational colleagues as well as a result of our response. What would we do differently? We made a bit of a cottage industry of incident reporting and escalation. We could have made that a lot simpler and been probably a little bit more explicit and clear in terms of our communications around that. I think really as well, we could have stood up our remote working helpline and guidelines a bit more quickly, and that again would have probably cut down on the number of service calls and some of the escalations that we had as well. We could be more robust, and always should be, I feel sometimes, in terms of what we are able to offer and the expectations we set, and being really clear about what is and isn't achievable for people as well. And then I think the thing we've all observed around a little bit of caution around some of the free offerings, free in inverted commas, that then have those repercussions for longer term revenue positions in the trust, particularly given we're all, very financially constrained now as a result of the responses that we had to make. So very broadly, they're probably the things we might have done differently. All of that said, really proud of the response. I think the communities, most locally and nationally, came together brilliantly well. We've still got lots to do, and there is absolutely more to learn. But it's, I think we've taken a lot from the period. Thank you very much.